Hello everyone, welcome to Logic Medico. Today we'll read the radiograph of this region. It is called the abdominal region or the kidney, ureter and bladder region, or simply called as KUB region. In this radiograph we can see it is a contrast radiograph of the abdominal region, AP view showing the following structures. First of all, we can see the lumbar vertebral column in the midline, and this is the T12 with the 12th rib, okay, and lower down we can see the sacrum, the two hip bones meeting at the pubic symphysis, posteriorly at the sacroiliac joint, the femur, where the femur is meeting the acetabulum. There the three parts of the hip bone is not united. We can see the triradiate cartilage mark. That means this child, this is not an adult patient, it's less than 13-year-old child, because triradiate cartilage unites at puberty. That's how we can make out the age. That is one thing. The second thing is the dye is injected into the vein, and from where it is been filtered through the glomerulus of nephron, and we can see here the minor and major calyces, the pelvis of ureter, the ureter coinciding with the tip of the transverse process of lumbar vertebra, crossing the sacroiliac joints, okay, and then ending up in the bladder, urinary bladder, which is there in the anterior pelvic wall. So here we can see a contrast radiograph showing the outline of the kidney, the pelvic calyceal system, the pelvis of ureter, and the ureter, abdominal and pelvic portion of ureter, and the urinary bladder. In this, the iodinated dye injected into the vein of the patient is descending down. So we call this radiograph as descending pyelogram. Why? The dye is getting filtered in the glomerulus of the kidney, and the dye is descending downwards through the kidney, ureter and bladder. Therefore, it's called descending. And why it's called pyelogram? Because pyelo refers to the pelvis of ureter, this funnel-like structure. Therefore, it's called as pyelogram, descending pyelogram. It's a contrast radiograph of kidney, ureter and bladder. First of all, there should be some normal functioning of the kidney. At least 25 to 35% of GFR should be intact to do this radiograph. Then only filtration can take place. This iodinated dye is injected through the vein, so it's also called as intravenous urogram or intravenous pyelogram. In addition to the name descending pyelogram, this is the other name. Any structural defect in the pelvic calyceal system, including ureter, any stricture, tumor, narrowing, ulceration, calculi like stone, tuberculosis, any of the structural defect, luminal defect, the defect in the wall, or congenital abnormality in the double ureter is there, single kidney is there, all this can be detected by this kind of radiograph called as descending pyelography, also called as intravenous pyelography or intravenous urography. So mainly to detect structural defect within the pelvic calyceal system, we do this radiograph. Thank you for watching and learning from Logic Medico. Kindly subscribe to our channel. Don't forget to like and share this video with your friends. Thank you very much.